I'm Shawna Rosner, your host of In-House Counsel Chronicles. Today, my guest is Todd Pearson. Todd earned his bachelor's degree in nursing from the Washington Adventist University and his JT from UConn Law. Law is a second career for Todd. We'll talk a little about this in a bit. And he's been practicing law for 9 years after working for a large public company. For almost 8 years, Todd moved to the private sector and is currently general counsel and chief of public policy and government affairs with Vibrant Emotional Health. Welcome to the podcast, Todd.
Thank you so much, Shawna. Such a pleasure to be with you.
Tell us to start a little bit about Vibrant Emotional Health.
Well, great. Vibrant Emotional Health is a wonderful nonprofit company. We've actually been around for 50 plus years at this point, primarily being a nonprofit serving the mental health needs of communities in and around New York City. But from a national perspective, our footprint has increasingly grown over the last couple decades with a steep trajectory of growth in the last 5 years as we serve as the administrator for the nation's suicide and crisis hotline 988. So that's a little bit about our company. We have community programs in and around the city that literally serve youth and help seekers across all the boroughs of New York City on one hand, and then on a separate side of the house, we do administrative services to keep 988 functional on behalf of a federal grant issued by us.
What an important organization. I can imagine that'd be rewarding. We'll talk a little bit about that in a bit. I want to ask, when you started at Vibrant Emotional Health, your title was general counsel, and soon thereafter, you added chief of public policy and government affairs to your title. What kind of led to this addition, and what are you charged with doing for the company overall?
Yeah, great question. I should quickly just mention towards the top of our call as well that, typical legal disclaimer, I am speaking just on my own personal behalf and experiences, not on behalf of Vibrant Emotional Health. All that said, though, of course, it's interesting how you can arrive at a new company and really find circumstances that necessitate, being flexible and saying yes when unplanned circumstances present. So, I arrived at Vibrant Emotional Health September 30th, actually, of 2024. And shortly thereafter, um, we as a company found ourselves with a vacancy in terms of an executive leader leading our public policy government affairs team. And in that respect, my boss and CEO of the company uh, was kind enough to entrust me with being the executive lead support of public policy government affairs. We do have a wonderful day-to-day senior leader who leads the organization from a day-to-day perspective and comes with a wealth of experience. Um, Lobbying down on Congress, advocating across a number of important stakeholders in the mental health community. So I am backed by a wonderful team as well as a wonderful leader of the day-to-day work by the name of Laura Evans. But at the end of the day, all of our departments need, that executive leader support. So yeah, probably about a month into being at Vibrant, Cara said, hey, our paths crossed in the past on working some of the public policy angles when Cara and I both were working at Aetna CVS, and said, Cara said, I have confidence that, you and Laura can continue to move this department in the right direction. And I said, of course, happy to support.
That's great. So love that you are flexible. And I want to go into for a minute about your background, because I think it's so unique. you spent, I think it was about 9 years before going to law school working for the U.S. Navy. Can you share what you did for the U.S. Navy and what led you to that particular position?
Yeah, so coming out of undergrad, I was a nurse in the Navy for 9 years. And in fact, entered the Navy through a pre commissioning program. So I was fortunate enough to even know while I was in undergrad that I would be picked up by the Navy. I knew what my duty station would be as soon as I graduated. And it was really presented the smooth transition for me. I always joke with my family and friends that I've historically been one of those people that never kind of knew what I wanted to do when I grew up. And I guess in some respects that might even still be true. But I entered undergrad thinking that I was going to be pre med and go down the doctor route. And, life and the circumstances that life can present had me go in a different direction. I found myself in undergrad with a young daughter on the way who now, by the way, is almost 20 years old. So just shows you how much time flies. And really needed to think about ways that I can accelerate a career that can support a family. So had great people in my life. I grew up in the Virginia Beach area, so plenty of family and friends that have served. So reached out to kind of my network of trusted folks on, help me think about how I can be a success in my career. And quickly the Navy came up as an option there, and nursing in particular quickly presented itself as a way to really launch into the healthcare space without obviously as many years of training as becoming a doctor. So one thing led to the next, and was privileged enough to get accepted into one of the pre-commissioning programs for the Nurse Corps and served in the Navy Nurse Corps for 9 years in a variety of inpatient and outpatient settings, some time overseas, but really enjoyed that time and honestly couldn't think of a better way to start my career.
That's amazing. I really love that story. And I'm wondering what led to your decision to go to law school and go to law school when you did.
Yeah, it was one of those on the same lines of like not knowing what you want to do when you grow up. I remember I guess it was in or around 2008 when President Obama was running for his first term and was running on a healthcare platform and healthcare reform. I was so energized by what could happen and needed to happen in the healthcare space. And I really just started getting this bug for, honestly, it was really even more of a public policy bug as I think about it now as one who's lived more of a professional life. It really was probably more of a public policy bug than even a law bug. But I just said to myself, I want to be in and around those that are making changes in a positive way to the healthcare system. And what is the best way to do that? And at the time was like, law school feels right. Um, Let me go to law school. Let me become a health care attorney and do my little part in making the larger healthcare ecosystem all that it can and should be. So I started taking steps in that direction to go to law school shortly after Obama's first, after the inauguration, and one thing led to the next.
Wow. So I love that you always had your eye on healthcare and kind of just pivoted, but stayed in the same industry. Over the course of your career, what are the biggest changes you've seen in the healthcare industry?
Oh wow, it's crazy. First of all, it's crazy to think that I've been in the healthcare space, whether that's nursing or law, for I guess just under 20 years now. And even in that short span of time, I feel like I've seen a ton of change. So, from my perspective, from a clinical perspective, as well as in a kind of healthcare administration perspective, things that stand out to me, no surprise, obviously, is a pivot to digital virtual solutions, care that is not centered or based primarily in a hospital setting or even a clinical setting at times. I mean, I guess it sounds naive to say, but I didn't see that coming. I kind of always thought of the patient doctor relationship as kind of one of those sacred relationships that can't be duplicated or replicated outside of true face-to-face interactions. But here we are in 2025, where at least for me and my family, I think the first place we look more times than not is telehealth and digital solutions. So that stands out to me. Definitely the pivot towards coordination of care and integration of care. There was a little bit of that when I entered nursing. I remember being involved in grand rounds where all the specialists and all of the supporting ancillary services met in a room to discuss one particular patient. And felt very kind of medical drama TV show like, where you have a whole bunch of people sitting in a room to discuss a patient. Coordinated care, as I've experienced throughout the years, is much more than that, and really is a level of coordination that is even behind the scenes. So really treating the whole person, and with that comes a whole level of like data sharing and data coordination and data protection that comes along with it. So the need to coordinate across the healthcare ecosystem has been paramount. And then the third thing that comes to mind is really just the increasing headwinds as relates to ultimately who pays for healthcare, right? Whether it is the government, whether it is private payers, the growing burden that is the expense of covering healthcare, things that models that have been promulgated to support driving down the cost of healthcare, things like value-based pricing models over fee-for-service models, all of that evolution in trying to do our best as a nation to curb the spend have been things that I think even in a snapshot of 20 years have evolved tremendously.
Sure. And you've worked in both direct patient care and for a Fortune 4 company, Aetna. Tell us about the biggest differences you've encountered between the two.
Yeah, I mean, it's interesting. There are differences that immediately come to mind. I mean, direct patient care is personal, right? And in particular in the Navy, I can at least speak to that experience. I felt like I was working in a world of limitless resource. That might not be everybody's experience in nursing, but definitely Navy nursing in particular at that time. If you think back to when I came into the Navy 2007, we were still very much entrenched in conflicts in Afghanistan and Iraq, and wounded warrior care was at the forefront. So, anything that was needed to get our returning wounded warriors back. I worked at Bethesda Naval Hospital, which was one of the main hospitals in the Navy receiving wounded warriors. And it was really just, it was all about them. And it was all about their families. And we had many soldiers, Marines, airmen that had very long stays in the hospital. And you got to know them and know their families. And resources were unlimited, really, as they should have been, in my opinion, for that situation. There wasn't a lot of, like, I think back to those days, I knew the name of my boss's boss, but I don't think I ever even had a, a conversation more than 5 minutes with them in all my time working. Like, the structure was you and the patients and any clinical support that you needed from your immediate supervisor. There wasn't a lot of conversation that had to deal with the larger operations and administration of being a nurse. It really was primarily focused on the patient. And then you contrast that to a big Fortune 4 company. Obviously, it's somewhat apples and oranges in the sense of nursing versus law, but you quickly learn that the enterprise goals and objectives are woven into everyday decisions that are made. And, you become very conscious of what it takes to get something done, the sometimes corporate inertia that can be there to get things done. Definitely became familiar not only with my boss's boss, but kind of, all the way up the ladder, so to speak. And, it really was, in some respects, a culture shock to enter the corporate world and understand that there's a way that one has to navigate themselves in the corporate world that is respectful of process and protocol. Not that the Navy doesn't have those things, but in the sense of direct patient care isn't always the immediate priority when the immediate priority is to save life and preserve life. So it definitely has been an experience in that transition.
So I'm curious about how you think your nursing background has been advantageous or utilized in your legal career.
Yeah, I mean, first and foremost, a couple thoughts come to mind. First and foremost, the way you're trained to think as a nurse very much is synergistic to the way one needs to think as a successful lawyer. So, as a nurse, you're taught to assess. API is the acronym that comes to mind. Assess, plan, implement, execute. Like you have to really be methodical in the way that you approach things and analytical in the way that you approach things. And spending a great deal of time assessing a situation before you take any further steps. And that has always been just a foundational skill set that to me has paid dividends in my legal career. I think there is a premium to asking the right questions, understanding the totality of the legal situation that you're asked to opine on. There's obviously a balance of doing so in a way that doesn't stall progress and keeps the issue moving, but truly having a full understanding of the business that's asking you the question, the client that's asking you the question, and fully assessing the situations, knowing the right questions to ask, and quite frankly, knowing what questions not to ask that can be distracting to keeping the objective moving, I think is also important. So, the first and foremost, the fundamental skills of how to think is something that I think has been a direct translation. The other thing is just some of the actual clinical components of being a nurse have directly translated. I think about times in my healthcare law career where I have had to be involved with advice and counsel that relate to things like clinical protocols and medical necessity practices and procedures. And just actually being familiar with delivering clinical protocols on the front end, I think has given me a unique vantage point as to how does that play out when corporations or healthcare payers, in my case, in the case of Aetna, are thinking about changes and updates to their clinical protocols. And so there's definitely been those direct, even clinical implications that I've been very fortunate to, and experiences that I've been very fortunate to weave into my legal career.
Yeah, seems like there is a lot of experience that it overlaps in the skills and the training. And while we're on the topic of training, I wanted to ask you what you think gave you the best training for becoming a general counsel.
Great question. I think it is the breadth of experiences that I was fortunate to have during my 7 years at Aetna CVS. What's great about landing at a company like that, or any other, large healthcare payer for that matter, is your opportunity to bounce around to a variety of roles in house and learn new things and learn new skill sets, learn new clients while continuing to progress your career has to me been the number one factor that has supported my growth towards general counsel. Just to put a finer point on it or to give some example, I mean, I at Aetna in 7 years did everything from supporting our HSA, FSA client solutions to behavioral health to Medicare to some value based payer things. And like each of those experiences, I can think back on and say, have uniquely prepared me to understand some of the substance that exists in those areas, but equally as important to understand how different clients think and operate. Not all clients are, equal, and not all risk tolerance is the same. And just understanding how to navigate amongst diverse clients and diverse client needs has been, I think, instrumental to my progress in my career. And I'd also be remiss to say, having those opportunities to work for different clients and different bosses also expose you to different leaders and mentors and folks that can be directly influential on your career progression. And I've been so fortunate to have exceptional bosses and exceptional clients that have opened doors to me for future opportunities that I didn't even anticipate would be the case when I knew them. Case in point, even my presence here at Vibrant as general counsel has a direct correlation to the fact that our CEO was my chief client as the president of Aetna Behavioral Health when I was at Aetna. So really, I've had a fortunate career so far that to me has been propelled by that diversity of in-house experiences and really getting to know a diversity of clients and a diversity of bosses.
That's amazing. And what do you see on the horizon for direct patient care organizations and the in-house counsel teams who work for them?
Mm. Well, starting first with the in-house counsel teams that support them, I'd say data, data, data. AI is obviously a buzzword these days. I would say whether it's AI enabled technology or not, data, the use of data, the protection of data is going to be paramount, I think, to the success of any in house counsel team. I don't know too many healthcare organizations that aren't strategically locked in to the idea of how do they best leverage their data. So I think it's imperative that in-house counsel teams are well equipped to think about those questions. I think as a corollary to that, also be equipped to think about technology. We talked about some of that earlier in the conversation, understanding technology and how the legal framework, the legal ecosystem and jurisprudence that supports technology driven solutions, I think is going to be imperative to the success of an in-house counsel team. And then thinking about the actual operations side of the house that's delivering patient care, obviously ties to the same things I said for in-house counsel, like leveraging data, leveraging technology. But I think there's also going to be an increasing push to understand how to drive patient-centered solutions that aren't, off the shelf rubrics that they apply universally across entire populations, right? There's definitely a need to, in my opinion, drive patient-centered and patient-focused care. You even think about some of that spilling into like pharmaceutical driven solutions where, there might be some point in the near future where medicine itself is even tailored to the individual chemistry and DNA of an individual. And, my solution might not be the same as your solution, Shawna. So I really do think in addition to you know, all of the typical things around data and technology that folks hear, I do see a near future for patient care that involves a level of individualization that the likes of which we may have never seen historically.
I appreciate that perspective, and I do look forward to seeing the future of healthcare. What do you like most about your current position?
I love our company and our mission first and foremost. I mean, this is my first opportunity working for a nonprofit, and a nonprofit that is focused on folks that are in their most vulnerable places in life, moments of crisis. When you think about 988, that crisis might be suicidal ideation, but it could just be having, a horrible day. And what it means to support somebody at some of their lowest points in life is so gratifying. I mean, here within the organization, we from time to time take moments to talk about what our CEO, Cara, describes as mission moments, which is really like, you know, an anonymous account of somebody who's accessed our services and what it's meant to their life. And it just, honestly, I've never had a job where um, I've been brought to tears hearing about the experience of somebody who's accessed products or services that we deliver. So, that brings me such joy and such fulfillment to know that we are an organization that are meeting people at their most vulnerable places in life. And then I would also say this has been kind of my first opportunity within legal I've been fortunate to have senior leadership titles within law dating back to, I guess, even my latter days at Aetna. So call that at least dating back to 2021-ish, right? I would consider myself a senior leader within a legal department, even if that wasn't the general counsel. But this is my first true opportunity to see the entire legal paradigm that the department is working on. That's everything from the legal issues that have to deal with the services that we're delivering. So, privacy issues, data issues, what it means to actually deliver our product, all the way through immigration issues and HR issues and intellectual property issues. Like, I have been exposed in this role to domains of law that in larger organizations like Aetna and CVS that I came from, you just have teams of lawyers that specialize in those areas. So it's been so fulfilling and rewarding to be an organization that's large enough to have some of these additional issues. My last stop, I also had the privilege of having line of sight from kind of A to Z of legal issues, but just due to the nature and scope of that organization, didn't have as many of the legal domains of issues as present at this organization. One thing that draws me to any opportunity in my law career is the opportunity to learn and do new things. And this opportunity has presented that in spades. So I wake up every day with a new opportunity to think about things in the legal career that I haven't thought about to date. And I find that extremely satisfying.
I love that you found this position and that it's so fulfilling for you. And I'm sure they feel fortunate that you're such a big part of them. I want to start to close by asking you any advice, if you were to go back to yourself when you first graduated law school, what advice, knowing what you know now, would you give yourself?
Good question. Say yes would be the first thing I'd say. And look, I think I've stumbled into that. I've generally said yes to opportunities, but it wasn't necessarily because I was mindful of what that could mean. But I think, take the chance, say yes, get out of your comfort zone, learn something new. Even when the opportunity doesn't work out the way that you would hope it could ultimately work out, I don't regret any yes that I've given. And it has always left me with a new skill set. So say yes would be my advice that I would give my graduating self if I went back in time. And then I would say enjoy the time as well, right? Like, law can be a demanding career. It can take a lot out of you. I think that one of the big privileges of being in-house is that by and large, you have some more of that life balance back. And I think it is so important in this day and age to realize that the work will always be there, that once you've proven your value to your managers and earn their trust that you have that trust and that you don't have to work every night and every weekend and do things that are at the expense of your health or your family. I think that would be for sure something I would tell my graduating self to enjoy the balance that in-house counsel can provide is so important for the longevity of your career. And the excellence in work product that you put out will always mean more than a poorly worded email that's sent out at midnight, right? Just take pride in the work that you do it well, and do it within boundaries, and know that it's okay to sprint with work from time to time, but you can't always be in a sprint, and that it's a marathon. And understanding when it's the appropriate time to sprint with your work and when you don't have to sprint is an important skill set to hone and to master for both the benefit of yourself in your career, but also for the benefit of your employer. They want the best work product you have for them, and understanding when it's okay to throttle back some and not work those nights and weekends are just as important as understanding when one needs to do those things.
Great advice. And in close, is there any advice that you have for attorneys who want to move within an in-house setting to the GC position? or like positions?
Yeah. Leverage your network, right? If one has clients that are in-house clients already, grow those relationships, do the best service you can for them, pick their brain. I think the best opportunity to go from a firm to in-house are those outside counsel that are in direct support of clients. So, keep your ear out, lock into your clients that are in-house clients, make sure you're supporting their needs as best as you can. And, have a mindset of being a business partner first and an attorney second. Because, when one lands an in-house opportunity, I mean, it's anecdotal, but I would honestly say 75% of the work I'm called to do on a day in, day out business is business advice. It's not legal advice and counsel. So be very comfortable and build your muscle as it relates to being a good business colleague. And if there are skill sets that you know that you can develop and strengthen that make you a better business partner, do those things. Get an MBA if you think that's going to be good for you. Do some financial training if you think that's going to be good for you. And in fact, having a strong finance background oftentimes is. But, develop your voice as a business partner and be very comfortable in understanding what your North Star is that you bring to an organization from a business advice perspective, knowing that on a day-to-day basis, you're going to be called upon and expected to give sound business advice. And honestly, the expectation is going to be that your legal advice and counsel is excellent. But if that's all you do, if that's all you can bring to the table, then unfortunately, for the most part, I think you won't find a successful in-house career unless you find a way to be that business partner to the clients that need you. You want them calling you for those tough questions, even if they have nothing to do with the law.
More great advice. Thank you so much. It's really been great speaking with you today, Todd.
Likewise.
Thanks for being my guest on In-House Counsel Chronicles.
Of course, my pleasure. All the best to you and your listeners.
Thank you.